men and women that had concussions, that women often had more symptoms, or they would report more symptoms. In our fast-paced medical system, a lot of women, when they go in and they are seeking help for concussions, they are often told, well, you just have anxiety or you just have depression. And because you're anxious and because you're depressed, that's why you're complaining about all of these other symptoms. There's a lot of research saying that female brains and male brains are very different. Obviously, hormones play a huge role in how our brains function, and women's hormones are constantly cycling and changing. And then, when menopause hits, all of a sudden hormones tank, and then the brain has to figure out what to do with that.
Dr. Wolf, welcome to the podcast.
Thank you so much. I'm so excited to be here.
Good to have you here. I want to dive into what do you believe is the biggest myth still in 2025 about concussions?
Sure. I remember reading a lot of research that was probably at this point like 7 years old, that would say that whenever you surveyed, men and women that had concussions, that women often had more symptoms, or they would report more symptoms. And I think back then people were just kind of thinking, oh, well, maybe it's just because women are more forthcoming with their symptoms. And that's why when we do these symptom surveys or we do this type of research, it keeps showing up that women have more symptoms. And I think that still today in our fast-paced medical system, a lot of women, when they go in and they are seeking help for concussions, they are often told, well, you just have anxiety or you just have depression. And because you're anxious and because you're depressed, that's why you're complaining about all of these other symptoms. And so I think that's still one of the biggest lies that is persistent, is this idea that, women are just more forthcoming with their symptoms and we're all just walking around depressed and anxious, which is why we complain about everything else. And so I think that's still like one of the biggest lies, because there's a lot of research saying that female brains and male brains are very different. Obviously, hormones play a huge role in how our brains function, and women's hormones are constantly cycling and changing. And then, when menopause hits, all of a sudden hormones tank, and then the brain has to figure out what to do with that. And so I think we have enough research now to say that, the anatomy is different, the hormones are different, and that there's a lot of important differences that actually set women up to experience concussions differently than men do, and that we need to start paying attention to that and honoring those differences a little bit more.
Yeah, totally. I hear that with people that I've worked with in the past, as they come to me and they said, they were telling me I had just anxiety. And that obviously wasn't the truth. It was a history of a brain injury that kind of brought up that anxiety and made it worse. What would you say when it comes to uh, symptoms? What would you say is like the number one symptom people are experiencing, or the worst symptom that people typically come to you when they've experienced the concussion or head injury?
Mm-hmm. Usually the most common thing people are coming to me from in my clinic is the post-traumatic headache. So that's, I think, the thing that, again, I see very frequently is being kind of mismanaged too, because a lot of people are being diagnosed with migraines and given migraine medication. But a post-traumatic headache isn't always identical to migraines and doesn't always respond in the same way that a migraine would to a migraine medication. And so I see a lot of people that are struggling with daily post-traumatic headaches. And then I also feel like a lot of those people, because they've been given so many different medications, and then they're also taking a lot of over-the-counter things like Advil or Excedrin migraine or ibuprofen, that they're also ending up with medication overuse headaches that are compounding the problem. So I deal with a lot of that mess frequently in my practice.
Yeah, that makes a lot of sense. I mean, head injuries are brutal, but headaches, like persistent headaches, I mean, that's one of the worst things to go through. I mean, you can't hardly think when that's the case.
Yeah, exactly. And I always tell people, if you're experiencing a true migraine, migraine abortive medications typically work. And so when I always ask people that question, it's like, okay, well, you had a concussion or brain injury, you've been given these migraine medications. When you take it, is it helping? And a lot of people will tell me, I can't tell is often what they say. I can't tell if it's helping. And so that, to me, that's usually a no.
Yeah. Yeah, that's tough. I want to dive into your history with the Carrick Institute and kind of what they've got going on. I've heard of the Carrick Institute, heard lots of wonderful things, but love to know your experience with them.
Yeah, well, the Carrick Institute really started out with Dr. Carrick, who we all like to call the godfather of functional neurology. And so Dr. Carrick he's a Canadian. He lives in Florida now, but he grew up in Canada and had a very successful chiropractic practice where he, right out of the gate, I think really did a lot of neuro rehab that was cutting edge at the time. Like he would bring patients into the pool and do like pool therapy, and he was always reading the research in different disciplines, and he was really doing cross-disciplinary functional rehab, like well ahead of the curve, so to speak. And so oftentimes I think when you're ahead of the curve, people think that you're crazy, right? Or they're just like, who is this guy doing these crazy things? But he was just so far ahead of his time that everything he's doing now has pretty much like been validated by research, to say that, oh, this is actually the path forward. This is like the how we need to look at this stuff. So he's just a true genius, a true pioneer, and an expert on eye movement disorders. And when you understand all the different classes of eye movements and the different pathways in the brain that control those different eye movements, you can start to really get a very amazing window into different parts of the brain and different systems in the brain to understand what's working and what's not working. And so I think one of the ways in which he contributed so much to the traumatic brain injury world was to teach clinicians how to understand eye movement disorders, how to understand vision, how to assess eye movements, and then how to understand the integration between our vestibular system, which is hardwired into our ocular motor system, and to be able to understand how those two systems integrate, and then of course how they integrate with the neck, the cervical spine as well. And so his like head eye vestibular rehab is, again, pioneering, so cutting edge, and so important to people with brain injuries because those systems are very often what are affected. And you're not seeing that on an MRI. You're not seeing this pathology on a brain scan. And so when many people are told that there's nothing wrong with them, these are the things that are wrong, that are continuously still being missed today, again, in that kind of fast-paced medical model.
That's so awesome. I'm so passionate about the idea of neuroplasticity, and unfortunately, I still see it today that people kind of think it's a buzzword or something like that.
Mhm.
And I'm like, no, it's so much more than just a buzzword because people will use it lightly at times. I just want to know like what your thoughts are around the idea of neuroplasticity and how it relates to brain injury.
I think one of the reasons why people maybe see it as a buzzword is because you can't reach out and grab it. It's something that happens over time, you know? And so it's not this tangible thing that people can say, oh, I took a pill and I have neuroplasticity, or, I mean, or
Yeah.
even if people are doing an exercise, they might not be able to like really feel in real time the effects of developing neuroplasticity. And so I think because it's kind of this intangible concept, people are kind of like, well, that sounds great, but I don't quite know how to like put my hands around that and hold it, right?
That makes
um,
a lot of sense. Yeah.
yeah. And so one of the things that sets apart a lot of the functional neurology practitioners in that community is that we do offer what are called 5-day intensives where a patient will come in and they'll actually run through a bunch of tests, Monday morning, and then a treatment plan is developed, and then they get treated twice a day for the whole week. And then at the end, there's kind of like, a re-exam in the middle and a re-exam at the end. And then maybe they get sent home with some homework and some follow-up. But so like I just did one of those last week,
Hmm.
and it, it's so cool to spend that much time front loading like the examination piece and really trying to understand like what isn't what are the sensory errors for this individual, and then
Hmm.
come up with a treatment plan, and then actually treat them for 90 minutes twice a day for an entire week. And when we were going through our re-exam on Friday afternoon, and I was saying, okay, well, this got better and this got better and this got better and this got better, she just interrupted me and said, did you think that this would all get better this fast? Like, she was like kind of surprised, and was like, did you expect this to happen? Like, did you expect all this to improve? And it was such a cute question because it was like so just authentically like curious. But again, that is the power of neuroplasticity. And that's neuroplasticity in action, because rather than saying to her, come see me once a week for the next 10 weeks, it was, come see me for 90 minutes twice a day for 5 days, and we will get you this much better in 1 week. Like, that's neuroplasticity in action right there.
I love that because sometimes I have to take off my hat and really be like, okay, this can happen quickly. It is over time, but like for the very best results, but it can also happen pretty dang quickly too, like you're talking about.
Hmm. Yeah. And sometimes, you can speed it up when you start stacking therapies on top of each other. So, again, a lot of people might go and do like a cognitive activity, but if they're just, on an iPad screen doing a cognitive task or a pen, pencil and paper kind of cognitive test, they're really just kind of doing one therapy at a time. And a lot of times what we do is we stack different therapies. So I might have somebody where I'm spinning them around in a chair, and then I'm moving their arm while they're following my thumb and doing an eye exercise. And then we're, adding in some sound element, or I have them wearing glasses for some color therapy. And so by stacking different therapies, you can also get a stronger impact as well, rather than just trying to again kind of focus on one thing at a time. And so there's, yeah, I think that that's one of the ways too in which we can get faster results in a short period of time.
Awesome. I love that. I want to go into your story and your own history of concussion recovery. If you remind me, you actually experienced post-concussion symptoms while you were taking care of people that had something similar. Am I right?
um, yeah, so I never had a concussion that was so severe that I couldn't function in life. So right out of the gate, all of my concussion symptoms were kind of like maybe vague or generalized, in the sense of like I had maybe some brain fog, but I could still work and function.
Hmm.
I think for, at kind of the peak of what I feel like was my post concussion syndrome, where I was like really symptomatic, which was, I would say, kind of like 2013, 2014. It was a lot of cognitive things in terms of like feeling very scatterbrained, maybe forgetful, squirrel brain for sure, just difficulty focusing. Um, in the process of moving from one state to another, I had to take a 4-hour exam on Chinese herbs, which was like a national board exam. And so when I started studying for that exam, I realized that every day I'd go back to my textbook and I would have completely forgotten what I had studied the previous day. I was also doing jujitsu at the time, and I would go to jujitsu and I would train for 3 hours a night. And then I'd go back the next day and I would have forgotten everything that I did. And so I wasn't progressing, because I just wasn't retaining information. Um,
Hmm.
so because I had been doing my job for so long, and because that was like ingrained in me, I think that like that's why I could still succeed at work. But when I was trying to learn new things, that's where I was really struggling.
Wow, yeah. I mean, and it's a big problem not being able to retain information. It's a frustrating because there was a time in my life where I remember I couldn't learn for shit, like if I'm being honest with you. Like, I mean,
Yeah.
and I would be plugging my face into a book practically, and it just
Hmm.
doesn't stick, right?
Yeah, yeah, super frustrating.
Yeah. Well, kind of moving on, I want to talk a little bit about acupuncture and your history of Oriental medicine. I think that's such a fascinating um, aspect, the Eastern medicine. There's so much wisdom there that we can learn from. I just want to know how that you're applying that these days in your practice.
Yeah. Well, I think, when now that I've been in practice for 20 years, and I've been a continuing education junkie, so I've never just do like the minimum number of CEUs that you have to do to maintain your license.
Yeah.
So when you look back on like your initial training, which was a 3-year master's program, those 3-year master's programs really give you like the basics, right? And then from there, just like with any discipline, you can kind of go and specialize in different areas and continue your education. And so I started out after I graduated. Well, and I should back up and say, like, from the age of 6, I always knew I wanted to be an herbalist. So I always loved plants. I always loved plant medicine. I grew up, with my mom had me on the fine gold diet, which was like no food coloring, no sugar. And so I grew up in an environment where that was normal, was to eat healthy and be thinking about nutrition and taking echinacea and vitamin C if you got sick, not just running to the doctor and taking antibiotics, right? So I kind of grew up with that whole vibe going on. Um, but so after I graduated, I specialized in fertility and women's health, and I studied, women's hormones, and I specialized in fertility. I helped people get pregnant, and so that was kind of the world that I lived in. Was kind of an integrative medicine and a restorative endocrinology model. So I was always thinking in functional terms, kind of. Chinese medicine, I often say, is one of the oldest forms of functional medicine because we never divided the body from the mind. And everything about Chinese medicine is looking at how everything connects. And so, we're not looking, unlike Western medicine, which is so siloed. The beauty of Chinese medicine in traditional East Asian medicines to be inclusive of all the other forms out there. It's a very holistic system from the get-go. Nothing is disconnected. Everything's connected, and all of the treatments are looking at where are the disharmonies and how do we bring harmony back into the system.
Mm.
And with all of my concussions, I got to the point where I decided to go back to school and get my doctorate with the intent of studying where can acupuncture and Chinese medicine help when it comes to brain injuries. And there was a lot of, I mean, there's a long history in the ancient texts on seizures, and there's a long history on treating stroke and on spinal cord injuries. And so they did have, a pretty long history of looking at different types of brain disorders and things that affected brain function. And so my initial emphasis was looking at how can we just improve blood flow in the brain, not just global blood flow, which is pretty tightly regulated, but regional blood flow. And our brain relies on the autonomic nervous system to send blood to where we need it based on what type of brain activity is happening in any given moment. And so I was really interested in the research looking at different acupuncture points and how they upregulated metabolism or activity in different parts of the brain. And there was some really fascinating research out there to say that 2 points on the wrist that are only about an inch or two apart from each other, if you needle one of them, completely different parts of the brain light up compared to needling the other. And
Hmm.
so it started to really make me realize that the what we call point specificity, or this concept that one acupuncture point has kind of certain functions that it supports, that concept was real. And so I just really started to dive into some of the research, the neuroscience research on acupuncture, and it was so fascinating to even know that that existed and that that was out there, because that's not the research that makes the nightly news, you know. Nobody else ever hears about it, and therefore they think that there is no research.
And that's so unfortunate too, because like as you said, I've looked at certain papers about brain scans and the instantaneous impact and how interconnected our body is. And I guess the way that I look at it, or the lens I look through, is as babies, we're formed like this, and so like our head is really connected to our lower body, but then we grow out of it like that. I don't know, is that kind of, am I off there or
No, I mean, I think that there's a lot of fascinating parallels that you can make with embryology and even Chinese medicine. I remember in my doctorate program, we had some pretty fascinating lectures on that type of topic. But even, for example, when you look at like what acupuncture points help to improve blood flow, we have this one acupuncture kind of a channel. It's called the stomach channel, and it's on the front of the body. And so what they say is that because this is such a big channel, like when you needle acupuncture points on that channel, you move a lot of blood. Like you can really kind of create a lot of improved circulation. But there's research to say that you actually have a preferential improvement in blood flow to the frontal lobe and the anterior circulation of the brain if you needle points on the stomach channel. Whereas if you're trying to preferentially increase blood flow to the posterior part of the brain through the basilar artery, well, then there's other points on the back that do that. So there is a lot of interesting research to just say that you can preferentially try to improve blood flow through the carotid artery into the internal carotid and then into the anterior communicating artery and all these frontal arteries that bring blood flow to the front of the brain versus the circulation in the back of the brain.
that's just so freaking cool. Like I love it so much. How interconnected things really are. And I want to move on to some recovery stories just to give people some light, some hope, and maybe they can relate to some of the coolest recovery stories that you've seen in all of your time as being a practitioner.
Yeah, I think that, one of the things that I see often that really affects people is when they have a sense of being disconnected from their environment. And so a lot of people, when they come in to see me at their initial visit, they may not be making eye contact. They may not be volunteering a lot of information right away. You can tell they're in pain. You can tell that they're suffering. And it's amazing to me time and time again that even after just one acupuncture appointment, where we might even only do like 5 acupuncture points, it's like very simple treatment, all of a sudden they get off the table and their eyes are more open. They're looking at me, they're engaging with me. I might see them smile for the first time. They actually laugh. They start volunteering information. And it's like I watch somebody kind of like come back into their body, and like re-embody themselves after just one treatment. And then people will say to me, they're like, I feel like myself again. And I mean, that's probably the best gift you could give somebody is to, bring them back into a point where they have the ability to then self-assess and self-regulate and then start making better decisions around maybe what they need to do to get better. So, I mean, that's just kind of a general thing that I would see play out frequently. The other thing is that when people have a lot of vestibular disorders where they have a lot of dizziness and feelings of like rocking and swaying, that creates constant anxiety and an unsettling feeling. And so when you can get somebody to a point where they actually feel stable and they can trust that they can walk in a straight line and that they're not going to fall over and that they're not going to all of a sudden have, these huge moments of vertigo, all of a sudden people can again start to like function in the world better. And so I love when I can see people, really get back to living their own lives.
And is that why you came up with the idea life after impact?
Um, Gosh, I came up with that name back in 2015. and I'm not quite sure how. I wish I had a cool story around that, but it somehow it came to me. I'm not quite sure when, where, or how. But I mean, yeah, I think the name kind of says it all. Is
Yeah, I really like that name because I think that for people that are in that situation, I think the one thing I want them to understand is they can get back to feeling good again. They can get back to living their life again, and even sometimes even better than before is kind of the message I want people to understand. What would you say like to somebody who's really just kind of in that state that they're in that survival state, they're not in their body? What would you tell somebody, or like what are some words of encouragement that you would give somebody that's in that state?
I would say don't give up hope. And a lot of times, we started out this whole conversation by saying, what's the biggest lie that is still existing? And honestly, I think a lot of times when people go to their doctor and maybe they've tried a couple of different doctors, maybe they've tried some physical therapy, maybe they've tried chiropractic, they've gotten some massages, maybe even they've tried acupuncture. I think a lot of people feel like they've tried it all. And it's very likely that there's something else out there, or there's another practitioner out there, even within one of the same disciplines, but just doing things differently, that has another piece of the puzzle. And so, like for me in the work that I do right now, most of people in my profession as kind of practitioners of traditional East Asian medicine, unless you've gone really far down a rabbit hole of learning neurology, like most of us don't have a ton of background information on neurology, neuroscience, neuroanatomy, neuroexamination, neurorehab. And so, you could maybe go to an acupuncturist, but if they really don't know much about concussions, then they may not be able to help. They might be missing important things. And so, where I'm at is I always see myself as a troubleshooter. Like people come to me and they've already been to 15 other providers, and so I'm the troubleshooter that says, what did everybody else miss? And maybe I'm not the person that can help them with that problem, but I just had somebody yesterday who was working with one of my other colleagues, and he said, can you come in and just examine this guy? Because I feel like there's some things going on that, that maybe still need to be addressed. And so I came in and I looked at his visual system and ocular motor system, and he had already been to a brain injury rehab clinic. But when I examined him, I said, well, you've got monocular diplopia, like, you've got double vision, but only when you're looking with one eye. And that's normally something going on with the eye, right? Like that, you need to go see a neurooptometrist or an optometrist to figure out what is happening with the eye that's causing that. And so I had to say, I'm like, I'm not the person that can fix this, but it's important to know that this is happening, because now you have another avenue to explore for why you're having blurry vision.
I love that. I respect that so much. Is we don't always have all the answers, and people. It's about getting the person better at the end of the day through by any means. It doesn't matter whether it's me or passing it off to the next person. I love that responsibility there, and um, when it I just want to dive a little bit into a recent study that you actually shared with me before we even got on this podcast from Dr. Carrick, and it was about epilepsy. Can you talk about that? Because I'm very passionate about epilepsy. I'm having used to experience 3 grand mal seizures a month. Now I'm seizure free, and so I'm very optimistic about the future of neuro rehab and epilepsy. So anyway, without me
Yeah.
talking anymore, I'd love to hear about the study.
Oh my gosh. Well, so full disclosure, I was laying on my couch scrolling on Facebook last night, and I saw that Dr. Carrick had posted on Facebook that his paper had just been published. And you were the person I thought of immediately when I saw that it was on epilepsy and a breathing technique. So so again, like you were the first person that popped in my head, and I said, I have to share this with Dr. Brody. And so I sent you the link. So I haven't even gotten to read through the whole paper yet. So full disclosure, I can't really get into it because I just heard about it last night.
All
Um,
good. And I'm right there with you because I scroll through it briefly. I haven't been able
yeah.
to read the whole article, but those are two things that I just believe deep down recovering from epilepsy is I believe it's a signal. I mean, especially with mine, because it was a cavernous malformation, and it was causing that electrical cascade. And I just felt like all I did was interrupt the signal again and again and again and again, even through vagus nerve stimulation. It's just anything I can do, breathing exercises, just kept interrupting that yucky signal, and I think it's made. So I'm excited to read that. Yeah.
Yeah, and so I think the paper brings up again a couple of interesting points, even though we haven't fully read the whole thing. But it started out by him talking about a woman whose son was having seizures, and she would blow air in his nose, and it would shut the seizure down every single time. And so that was what started the whole paper was saying, Dr. Carrick is never attached to any one method, and that's also what's made him really brilliant is he is attached to understanding the mechanism of action. And like whether you're juggling kittens in the air or doing acupuncture, like as long as you can explain why that therapy works and it makes sense, then he's cool with it, right? And so I
I
think
love that. Yeah,
yeah.
that's cool.
And so I think that, he somehow heard about this, this technique and wanted to understand it better. Like what is the mechanism of blowing air in the nostrils? How would that shut down seizures, right? And so while I haven't read the whole paper and I can't really comment on it, what I can say is that one of the rescue therapies that I use very successfully in my clinic when somebody comes in with a migraine is what we call auricular insufflation, where you just take an insufflation bulb and you puff a little bit of air into their ear once every 3 seconds for 90 seconds. So I literally go 1, 2, 3, 2, 2, 3, and I count to 30. And usually by the time I get to 30 puffs of air, the patient will say their migraine is gone.
Wow.
Yeah. And so I've also seen different therapies where they are doing nasal insufflation for migraines. So there's a lot of research. I don't say a lot of research. There's some therapies out there where you're actually doing some kind of puff of air either into the nostril or the ear that has some kind of sensory effect that resets the system. And so I think that I mean, isn't that great that, just a puff of air is the thing that actually helps rather than some kind of toxic medication with side effects or some kind of, $44,000 of HBOT or whatever it might be.
Right. Yeah, these days it's like have to sell your soul to get some help, it seems like, but
Exactly. And so if just air is the answer, it's like, wow, like that, we need to pay more attention to that.
it's hilarious. I'd love to end it with well, we're gonna cover some of the things that you got going on, but before we even dive into that, I just want to know like what would just general advice you would give somebody on how to recover. Let's just say it was a typical concussion um, that has been persistent over 6 to 12 months. And it was, let's just say the cause was sports or something like that. What would just some general advice be there?
Yeah, I would say when somebody has persistent symptoms, there is usually something that has gotten missed up until this point. And so, for example, let's say somebody has daily post-traumatic headaches. They may have been misdiagnosed with migraines. That could be one issue, right? Or let's say they went to their eye doctor and their eye doctor did a standard exam and said, well, your eyes are fine. So then they have gone through life thinking, well, my doctor told me my eyes are fine, but man, like I have light sensitivity. I don't like looking at computer screens. My eyes are always tired. I have eye strain. I get headaches as soon as I try to read anything. So I think that what people need to recognize is that even when they've been told that something is normal, they have to keep investigating because it's very likely that something has gotten missed. And so maybe instead of going to see a regular optometrist, go see a neuro-optometrist that has specialized training in, concussions and brain injuries. Instead of just seeing a regular chiropractor, like go find a chiropractic neurologist, somebody that's trained through the Carrick Institute. Instead of seeing just a regular acupuncturist, like go find somebody that specializes in neurological disorders. I think that, usually, like I said, something's gotten missed. And even like the physical therapists that I know that specialize in vestibular rehab, like they have so much more continuing education than just a standard PT does. So even if someone's already done physical therapy, it's like go find somebody that specializes in concussions because that person is probably going to have more tests, more assessments, more background knowledge, and a different approach that might help you to move forward. So that's when I said, like, never give up because there's probably somebody else out there that's like studied this, and gone down the rabbit holes, and they've got a solution, they've got an answer.
Yeah, exactly. And medical doctors, even to this day, are only given 2 to 3 hours on average of concussion training. So that's quite limiting in that aspect. Lastly, let's just talk. You recently had a book that came out. It's a big one.
Yeah.
How was writing that book for you?
Yeah. So what's really funny is that I started out thinking that I would create some online courses for people on concussions. And because I have a bunch of online courses, for practitioners. And I was like, well, I can just easily translate that and start actually putting out content directly to people that need it. And so I took an entire week off of work in March when everybody else is like going to Cabo. I took a week off of work, shut my clinic down, and I sat in front of my laptop with the intent of creating a bunch of online courses. I spent an entire week staring at a blank screen. It was
Mm.
like major roadblock. I mean, just like writer's block, everything block, like everything was blocked. And it wasn't flowing at all. And then I had written like a 6,000 word ebook, and I was going to launch that ebook out as a like, hey, here's my freebie, and if you like this, well, then you can buy some of my online courses that I don't have, right? And right as I was about to launch this little free ebook, which kind of had an outline of what my current book is structured in terms of the different symptom categories and kind of how we talk about it. And somebody reached out to me on Facebook, and I didn't know who it was, and they just said, "Hey, have you ever thought about writing a book?" And normally I would ignore those messages when they're from somebody I don't know, but I clicked on them and I was like, "Oh, well, it's a chiropractor who knows a lot of the other chiropractic neurologists through the Carrick Institute. So it's like we have all the same community of people. This isn't some like scammer, right?" And I was like, "Oh, and they have a publishing company." So we ended up talking on the phone for an hour, and by the end of it, he kind of motivated me to turn my 6,000 word PDF into a 600-page book on concussions, which I thought was maybe going to be like 200 pages, not six. People have thanked me for using big font. So
Well, I have to say, I read a lot of it. It was really in depth, really, really good. And whether you're a practitioner or somebody that's looking to, it says discover the missing pieces of recovery, definitely check this out. And I know how hard it is to write a book, and how much information there is. So it's really, I hate to say it, but it's a no-brainer.
well, thank you. Once I, made that decision to write a book, then I feel like I was in my flow state for the rest of the year because that thing did just like pour out of me. And I loved writing it. And I actually counted, it has, I think, 314 peer-reviewed papers that I referenced in it, with like half of those being certainly like recent, as in the last 2 to 3 years. So I really wanted it to be, the most cutting edge information, but also a troubleshooting guide. And a lot of my patients call it a choose your own adventure for the brain, because you don't have to read it cover to cover. People can fill out the little survey in chapter 1, and based on how they answer those questions, it gives them some guidance on what chapters are most applicable, based on what they're dealing with. So it's kind of just a nice reference guide for people who feel stuck.
Fantastic. Well, before we end this, is there anything else you'd like to talk about, or things that you got going on, or anything like that?
Well, I have my podcast as well, Life After Impact, the concussion recovery podcast. And I've just, I've really loved the opportunity to meet people like you, and have guests on the show, and get everybody's perspective on this really complex, condition. So I've really loved doing the podcast. And I would just say a lot of people have never heard of functional neurology. And I do talk about it in my book and try to explain a little bit about the mindset of functional neurology. But if people are really feeling stuck, and they have a lot of neck issues, eye issues, dizziness, balance, vestibular disorders, and pain, I just really feel like a lot of the practitioners that are doing these 5-day intensives, or doing the functional neurological rehab in their clinics, have a lot to offer. But a lot of times we're kind of, operating in the shadows, like people don't even know we exist out there. So I'm hoping to shine a better light on that.
Yeah, and I can totally relate to that, because it's just, you don't know what you don't know, and until you discover something that may work for you. And when you know something new, it leads you somewhere new. So um, lastly, I just want to, where can people find you on social media, or where's your preferred method where somebody could reach out to you?
Yeah, probably through lifeafterimpact.com. That's where I've got information on my book, my podcast, how to reach out. And you know, email is probably the easiest. I'm not always on social media checking DMs these days. So yeah, probably lifeafterimpact@gmail.com is the best. And then my clinic website, it's healingresponseneuro.com.
Fantastic. Well, super cool having you here. I hope everybody has a great rest of their day.
Awesome. Thanks so much for having me.